says resting bitch face for the next 2 months. RBF for the next 2 months.
My smile is gone. Does it look normal?
No, smile. No, smile.
Oh, shoot.
Is it moving?
No, you look scary.
I think I got a little bit too much Botox in my jaws, and I cannot smile. The face won't pull up to smile.
You got all your wrinkles are gone.
So I have to wait for it to wear off a little bit in a couple weeks, and maybe it'll be normal again.
Yeah. So this is somebody who obviously the injector is not very skilled at doing what's called masseter injections. So you have these two giant muscles on the sides of your jaw, on the jawline, on the backside. They're called the masseters. They're the biggest muscle in the jaw that helps us open and close and chew on things like. And so when you actually bite down really, really hard, you can actually feel the masseter come out every time you open and close your mouth. Now, a lot of times in treatments for TMJ, what's also known as TMD, temporomandibular disorder. So TMJ is the temporomandibular junction. That's the junction right here where your bottom jaw actually attaches to your skull. So a lot of times people have inflammation there. It's caused from grinding. So this masseter muscle is responsible for grinding at night when it overworks. It's responsible for a lot of stress in the jaw. It's responsible for really thick jaw lines. So a lot of females will go and will inject Botox into those masseter muscles, and what it does is it relaxes them. So it helps really treat TMJ and grinding. Grinding, also known as bruxism, is the other word for grinding. So it really helps with that. Helps with migraine headaches a lot, and also will help thin the face out. So a lot of times we'll treat it, and it takes a while, obviously, because when you arrest the muscle from working, especially a big, thick muscle like that, it's going to take a while to atrophy. But all those different treatments are used when we inject the masseters. Now, the problem is that right in front of the masseter muscle is something called the rhizoris muscle, and the rhizoris muscle is responsible for smiling. So when you smile and the sides of your lips pull up, you can see in this photo, the rhizoris muscle pulls up the very edge of the lip. And so if you actually are trying to inject the masseters and you go too far forward, then you can actually hit that rhizoris and, like this lady had, stop the person from smiling. So when she's trying to smile, she just has this really scary, like, looking at your teeth kind of look. So again, the good thing is that after about 3 months or even a few weeks in her, it just depends, that rhizoris muscle is going to come back to life because the Botox will wear off. It could last up to 3 months in her. We don't know. We don't know how much got injected into the rhizoris. With that being said, this injector definitely wasn't highly qualified for the masseters and how to inject them. There is a specific way, drawing a line from the earlobe to the edge of the mouth, and then also making sure you're palpating the anterior border of the masseter, drawing certain lines everywhere on the face to make sure that you are always injecting into the masseter muscle. Again, this could also be a freak accident. Maybe they went too far forward. However, that usually only happens on one side if somebody has an issue, one side or the other. The fact that she has it on both sides means that the injector just didn't really know what they were doing. So you want to make sure you go to a highly skilled, highly certified injector who knows how to treat the masseter muscles for your TMJ, for your headaches, or for your facial thinning, as well as make sure that you know that, hey, even if you have a side effect like this, it's not going to be permanent. It's going to go away so that you can avoid smiling like this.
That's the scariest thing I've ever